Test this. How does this sound? I've been warned that if I hold it too close, I will overwhelm people. I said, how unlike me. Can you hear me okay in the back? Feedback and echo, Kelly. Feedback. Okay, I'm going to test this again. We're still getting a feedback. Echoing. One, still there. Do I need to hold it lower? Okay, I'm going to try again. Is third time the charm? You hearing an echo, feedback? Some 1, 2, 3. How's this? Better? Okay, if that starts to pick up again, someone please raise your hand so we can correct an actual course. Can you hear me in the back? All the way? Can you see me in the back? So Italian lakes of mine do not help in this kind of a room. First of all, I'm Ari Basil-Wagner. I'm the project manager on the Benton County Criminal Justice Assessment. And I'd like to welcome you all here and thank you for coming tonight to hear our fourth forum, in the place we started the kickoff to this assessment. We are now bringing you the second to last update on the work that includes the 3 scenarios that we talked about from the very beginning. So I know that many of you come from a long day of work, other responsibilities, and chose to be here tonight to hear about this. And I'm very grateful and respectful of your time. So thank you for being here. Of all the things you could be doing tonight, softer, down, lower. How's that? All the things you could be doing tonight, standing in line for a ticket for $1.6 billion, and you're here. So thank you. Wait a minute. I'll be right back. Commissioner, can I ask you please to start with a welcome as the lead commissioner on this? I'd love for you to kick us off. Thank you.
Good evening, and thank you for coming out tonight on this first evening of rain that we've had in quite a while. We are excited about the fact that we are rolling out this stage of the assessment. What we'll be presenting tonight is an overview of the overall criminal justice assessment so far, plus a set of 3 scenarios in terms of our potential investment in the criminal justice system. We are looking forward to having a discussion with all of you, getting your feedback so that we can incorporate into the final draft of this assessment document, which will then lead to further exploration and moving into program and project design phases. So with that, I would like to thank all of you who have been coming to our meetings all along the way and providing your input. And I would like particularly to thank our steering committee, many of whom are in the audience, and move into the presentation itself.
Hi, my name is Carl Becker. I'm the project manager for CGL. Doesn't seem like that long ago. We were here in February just kicking this off, so we've been working closely on the analysis part of the project, working with Ari and the steering committee, and we think we've got some good results here to share with you tonight and some scenarios that will be interesting. So with that.
I saw some people having a hard time hearing. It's never been an issue with me. So this is what we're going to do with you all tonight. In terms of leading up to discussing the scenarios we're suggesting, we want to put that in context on how we got here. Many of you have followed that process, so you may see some slides that you've seen before, but we're briefly going to put this in context by going through the background, what analysis was conducted, the findings of that, and then present the scenarios. There should be a drum roll at that point. So. I love that. The project team, you've met us. Great Oregon Behavioral Health is an organization I'm part of, and specifically working with the Center of Excellence on Behavioral Health and Justice Integration. the goal of diverting people with behavioral health issues from the criminal justice system. But the structure of this and how we work together is much broader than GOBHI and CGL, of course. There was a collaborative effort among the Board of County Commissioners, the partner organizations in the community, the operations team that met pretty much weekly, every other week, to look at the process and progress on this work, and the steering committee that helped with guiding us through the work. The center of it all is the Benton County community and how the community members were involved in giving feedback. And we'll talk a little bit more about that. The project approach, I stopped being able to read that print probably 20 years ago. There's a four-phased approach, and the one I want to highlight is where you are tonight. Developing the solutions, looking at the documented issues, what alternatives we're suggesting, what data is required, and some cost-benefit analyses as part of that. So if there was a map that said you are here, it would be in this space. Still good with the sound? Wonderful. I want to take 1 minute as we get into this overview tonight and present the scenarios to remind everyone that, unlike past efforts that looked at a certain segment of the criminal justice system, this analysis was a comprehensive review. So it started with, and we call these intercepts, they're decision points or touch points of the criminal justice system. We started in the community with what works in the prevention aspect of things. Intercept 1 is law enforcement, 911. Intercept 2, initial detention, the initial court hearings. Intercept 3 is the jail and courts. 4 is reentry. 5 is community corrections. So we begin and end in the community. This is how people move through this system. And it's an important piece, and why I took a moment with you all to start us off is because we're going to refer to this later on. So I want to make sure we're grounded in that. If you look at the poster, billboard, on the side of the room there, CGL actually conducted a full assessment of how people move through the system and what happens at each one of those decision points. The background. Analysis. So we're going to talk about what data we looked at and some of the highlights of findings, certainly not the details of it. That has been presented in previous presentations. It's online. It will be detailed, of course, in the final report. But in order to talk about these scenarios, we want to highlight the why. What's your why? I think is that new book. So it is a multifaceted approach in the analysis. It looks at the hard data, quantitative data, arrests, capacity, policies, force release, jail, courthouse, offender needs. In the qualitative pieces of information, because we combined it, we looked at getting feedback from community members on their input on what they think is a good vision for the criminal justice system, what are effective components of it. And the research. What does the literature review say about evidence-based practices? And what previous assessments have been conducted and what were those findings? Impact the social determinants of health and trauma-informed care. We took all of this to synthesize the findings into the scenarios. Make sense? The history, how we got here? At least tonight, not the big gestalt, why are we all here? That's a longer presentation. So we're going to show the highlights of some of the data, and Carl, I'm going to ask you to walk through that. Thank you.
So in looking at demand for services in your system, we look at criminal behavior in the community, and the easiest proxy for that is look at arrests. And like many communities throughout the country, arrests have been going down here in Benton County, at least through since 2014. And you can see from here, this breaks down the arrests by category. So the vast majority of arrests are behavioral crime arrests. These are drug offenses, DUIs, disorderly conducts, relatively minor type of offenses. The red bar you see there are property crime arrests, vandalism, theft, larceny, and the black bar as person crimes arrests, which are crimes of violence typically. The interesting thing to realize here, you're looking at total arrests. So these are by the Sheriff's Office, by Corvallis Police Department, Philomath. And the important thing to remember here is about a third of these arrests result in a citation and release, and they don't see the jail ever. And that's basically because of capacity issues at the jail. About 7%, I believe, go to the jail on a warrant, and the rest are booked in as a new offense. So how do you compare with your peer communities? So this breaks down arrests per 1,000 population. And you can see that Lane County and Benton County top the list essentially. 38 arrests per 1,000 for Lane and 26.8 for Benton. Polk's not far behind. So relative to Yamhill, Polk, Lane, Lincoln, you have a relatively high arrest rate, which is a proxy again for crime. So you have a relatively high crime rate compared to those other counties. You can see at the very top, the state of Oregon's arrests per 1,000 is 16.8. Now, the jail capacity here, conversely, is very, very low. Again, comparing to your peer communities here, Benton County has a capacity here at the local jail of 40 beds. Lane County, 407, Lincoln, 161, Lynn, 230, and on down the line. So although you have a relatively high arrest rate, you have a very, very low jail capacity rate. This breaks it down similarly by incarceration rate per 1,000. And again, you're very, very low compared to the other communities. This is by definitely the lowest incarceration rate in the state of Oregon. And working across the country, it's one of the lowest rates of incarceration we've seen anywhere across the country. What this does to you in terms of impacts on the justice system, we look at failure to appear as a percent of hearings. So these are people who have been issued warrants to show up in court. This is the percent of people who fail to show up. And you can see it's been increasing from 13% in 2014 on up to 16% in 2017. And in many cases, these are multiple failures. They don't show up the first time, they receive another warrant, they don't show up the second time or possibly a third time. And just to give you some sense of how this compares, most jurisdictions consider anything above 5% failure to appear rate as excessive. This really is an issue in the integrity of the justice system. People are asked or required to come to court. If they don't come to court, it's a real issue. And you can see there that 5% rate, that is what we consider basically an acceptable benchmark across the country. The other consequence of your limited capacity in the jail is forced releases. When police bring an offender to the jail who has to stay there because of the nature of their offense and they're full, they have to let somebody out. So this is forced releases by month over the last 3 years. And you can see it's been increasing rather steadily since 2017, averaging upwards of 40 offenders released per month as of about a year ago. And these are forced releases of repeat individuals. So you'll have an individual who's been released on forced release into the community. They're rearrested, brought back, and released again because, again, lack of capacity in the jail. All right, we're going to talk about the frequency analysis.
Wanted to take a look at for individuals who are booked at the jail, how often do they come back? And so we looked at data that covered a 2-year period, so we had a sufficient amount of time to follow folks. There were 1,313 individuals that we included in this study, and they had a total of 2,001 bookings at the jail for that whole group. So what that meant was 72%, almost 73%, had one booking during the study period. It came in once, 72%. 15% had 2 bookings during that time. 12%, 12.3%, had 3 or more bookings, which in summary is what you see over and over again as we look at criminal justice data. There's a smaller group that really have a revolving door at the jail. And it looks something like this. 12.3% of all of the total individuals had 33% of all bookings. It's a really important piece on how we look and use data, look at and use the data to help identify what should responses be. And this is one of the ways we look at how to narrow in at a subgroup that hasn't been successful the first or second time. The offender needs, Carl, you want to talk about?
So looking at some of the offender needs, the first thing that jumps out is that there's not a lot of good data on what offenders need in terms of programs, deficits they have coming into the jail, be it mental health issues, be it homelessness, be it behavioral issues. There's just not a lot of data being collected on the inmates at the jail currently. There's no standard assessments in terms of their risk to reoffend, their risk for various types of social issues. What we can look at is the number of inmates in the jail that receive prescriptions for mental illness, and that's about 30% of the, on a cost basis, 30% of the prescriptions issued at the jail are for mental illness. So that tells us that a substantial portion of the jail inmates have some type of mental issues, which is consistent with what we see across the country. The other indicator we have is the inmates we send to NORCO, Northern Oregon Regional Correctional Center. These are mostly sentenced inmates, and they have a pretty close to state-of-the-art facility over there. They have a very sophisticated inventory of need instrument that they put their offenders through. So for Benton County inmates, they assessed 111 of them, found 22 of them in maximum need of program services, 71 medium, and 18 with low needs. And of those inmates, they put them into the following programs: mental health services, contact with a psychiatrist to manage their medications. There's a residential mental health unit, and they also have substance abuse treatment, anger management, parenting, job readiness, and cognitive behavioral programs. So they funnel all those inmates into those programs based on a standardized assessment of what their needs are. And that's essentially the gold standard in terms of what we see in jails around the country. Inmates with a 12-month mental health program. This is data that is provided by the Department of Justice, and it shows basically 64% of inmates in local jails report a mental health issue compared to 45% in federal prison, 56% in state prison. And a lot of that gets to the, I don't want to say the nuisance factor, but people with mental illness who are homeless, who get picked up for a variety of minor types of crimes and then cycle in and out because there's really no good services or programs to deal with their issues. Substance abuse issues, again, this is the DOJ data, did a survey of the jail population, and 48% of the jail population in response to their survey indicated they had a substance abuse problem. No response. No response. And again, another study for the jail population have mental illness and co-occurring addiction issues. And Ari, I think you did the research on this one.
For people who have mental illnesses and co-occurring substance abuse issues, a very large percentage, a high prevalence of those individuals have experienced trauma in their life. As children, multiple areas of trauma as adults. And this study looked at what percent are saying for those in the jail population, again, national data, those in the jail who have a mental illness, how many report either a lifetime exposure to trauma somewhere in the course of their lives, and how many are experiencing it currently for men and women. And as you can see, for the lifetime experience for men, they reported 89%. For women, it's 96%. So we might as well just say most, if not all, had exposure to trauma. And that link between trauma and mental health conditions is very, very strong in multiple data sets. Currently experiencing trauma, 86% of the men and 74% of the women. Quick question for clarification. It was defined. Experience of having been exposed to or experienced physical abuse, emotional abuse, sexual abuse. had an adult member in the household who had a mental health issue while you were growing up, had an adult member in the household while you were growing up who was in the correction system, a divorce that left strong issues of abandonment. So they were specific with that. And social determinants of health, the other influences in our community safety and in crime rates is ability and access to housing and other support services. Those people that they've done studies with, offenders, where it helps with transitional housing, for example, have lower recidivism or reoffense rates than those who don't. How did housing, how did employment, how did issues around poverty get connected with crime? Well, think about it. Let's just do a walkthrough of an individual for a minute. You have someone in jail who's had a history of many relapses with substance abuse issues. They're not going to treatment on their own, not the prevention services that are in the community. Highly addictive, acting out, a lot of criminal behavior, negative peers, other criminals who are in part of their life, their main go-to folks. They're in jail, and what happens in jail? Forced sobriety. Stabilization of some other issues for the first time. And with people who suffer from behavioral health issues, there are these moments, these windows of opportunity, and sometimes Venetian blinds that just peek into a moment of stability and an insight that maybe I don't want to continue to do this, and there might be more in me. I can rise above. Get out of jail, want to hook up with support services, or maybe hear about it from other inmates or from staff at the jail who share that information, because that happens a lot in Benton County. Staff are highly dialed in. Go back into the community, get a job with a record, multiple offenses. If you can find a rental, be able to fill out that application with multiple offenses. So what happens is quick decompensation for people with stress and these issues. Easy relapse. The next easiest place is to go to those old friends and those old ways and look, this is showing me what I've always known. I'm just not worth it. Or as people who I interviewed in the jail as part of the community engagement told me when I asked, what do you think would make a difference? One of the number one responses was, if I felt someone cared. If I had a mentor. Not to mention being able to get employment and a home. So that's how social determinants of health are intertwined with someone's ability to live proactively. Community input. How's the pace for everybody for this background piece? I'm seeing, okay, pretty good. Okay. Community input. As you know, we had several forums. We attended community groups to get input. We went to the fair with surveys and heard from over 200 people. Wanted to do that because I realized that not everyone has the ability to attend a community meeting. It's a hard thing to get to and do. So I wanted to just meet more of your community members. So we went to the fair and asked them to fill out a survey. The themes from the community input were as follows. Focus on the full continuum. Don't do a soundbite or snapshot. Focus on the full continuum, from prevention to reentry. Look at what works. What does the research say? Consider the needs of the victim when you're looking at community safety. Treatment, mental health treatment, substance abuse treatment, physical health needs. This is so aligned with what we know works and was echoed over and over and over in the community meetings. Reintegration, make sure it has support services. Service needs for people with mental illness and addiction issues, behavioral health. Came up at almost every meeting. Consider the social determinants of health. It was the community members that said do more research around housing, employment, education, trauma-informed care, and those interrelatedness of being able to move past criminal behavior and more successfully living in the community. Think about services for high risk of juvenile offenders who are aging out of the juvenile justice system. Prevent them from becoming adult criminals. That's actually a very low number in your community. Your juvenile justice system is super successful. Have a high evidence-based practice approach. Training for law enforcement, staff, and people who work in the jail. Responses for members of ethnic minority communities and advocacy groups. These were fewer in number. I would say of all the responses, about 9% of the responses. And there was a theme, even though less in number, definitely a theme in the responses. We need to have more data that helps look at the extent to which national issues for communities of color exist in Benton County or don't. We need more data on that. And their individual life stories that show that there's been experience. For example, a gentleman in one of the groups who is African American said, there are times I go into different communities and the police are called on me because people in the community are afraid. Do the people that you're doing this assessment for understand that? What are they doing about it? What's happening there? And overall disconnect between those stories and voices and the system that responds to community justice. Research. Start here. We're going to segue into some of the research. We looked at previous assessments. This is the biggest laugh tonight. Well, one of them was we don't want to repeat things that had been done. And part of that, certainly that came out of that, was looking at the courthouse in Benton County and its structure, its survivability in case of in an earthquake scenario, how it supports effective implementation of the work. So there you have it. It's such a beautiful building, and I love that building. I can feel the history in it. I didn't realize the history went back to 1888 when y'all built it. So there are some issues, of course, with having a building that's the oldest courthouse in Oregon that's still being used for its original purpose. The only one. And I tried to think of some points of reference to put that in. So something for me, like when my friends have a birthday, I put on the card the #1 song in the country when you were born. Again, just hang with me here. You'll see where I'm going. So the year I was born, the #1 song was The Twist by Chubby Checkers. When I say that, you can kind of hear him. You can kind of see it. I could do a better one if I had the music. Not the #1, because the Billboard started a little bit later than 1888. But the most popular song in 1888 was Where Did You Get That Hat? Can anyone here sing or hum that song? No, of course not. Well, maybe. 1888. You're singing that. What else was happening in 1888? Well, our flag only had 38 stars on it. 12 territories had not become part of the United States of America when your courthouse was built. And a patent was issued that year for this thing they called the auto. I love that picture. Like, I really want one of those in my garage. I love vintage vehicles. And I would not drive it to work every day. Well, people in this community go into this building every day to conduct incredibly serious business. And what those assessments showed, aside from it not being safe in terms of an earthquake, were things, I don't know, Carl, if you want me to keep going, you want to jump in? Got this tag team thing going. It's disjointed in the way it's laid out, so there's not adequate separation of public and staff separation. There's a lot of high risks. It's a risk management issue. It's a safety issue. I can summarize all this stuff up there in those 2 sentences. But some of the examples are you have 1 jury room for 3 trial courtrooms. I heard from the judge that sometimes they move the juries around. I did say this out loud because who knows if I'm ever going to have to see him in an official way. But I thought that's kind of like a musical jury room. You know, we got to get the other group in here. There's no attorney-client conference rooms. So in a scenario that requires a lot of sensitivity and privacy, they're searching for a place to meet. It's time-consuming. It's difficult. And overall, according to the industry standards, which CGL has supplied, functions of the county, including the DA's office, should have about 37,000 square feet. Your courthouse has 21. The Law Enforcement Center. Let's switch over and talk a little bit about that.
The current Law Enforcement Center, where you have the Sheriff's Office, 911, Emergency Response, Corvallis PD, has a number of issues. As was pointed out to me, you have an emergency response office that's response to flooding, which is in the basement, which also floods. So they have firsthand experience dealing with water issues, apparently. The 911 center space is undersized. Generally speaking, the entire facility is undersized for the volume of staff that use it for the law enforcement functions for the county. Thinking being that if, in fact, there is in the future for the county a county justice complex with potentially a new jail, with potentially a new courthouse, given the issues with the law enforcement center, it would make sense to have a co-located law enforcement center with those other facilities. That would be by far the most efficient, most effective way to manage your county's justice functions. The jail. The jail, of course, has issues. It was built in '76 as a temporary regional facility with the capacity for 27 offenders, and it hasn't aged well. It was never intended to age, serve this function for this period of time. Mechanical systems, plumbing, and electricals all wearing out. There's no space for program services. Sight lines are not good in the facility. Processing people through there requires a lot of effort on the part of staff. And I have to say, staff do a fantastic job maintaining the current facility and keeping it going. But it's showing its age. It's showing the fact that it was never designed to support the number of inmates they currently even have in there. And it's badly in need of replacement. And as we said before, the diminished capacity you have in the jail really affects every other aspect of the local justice system because it has limited capacity. You have to release people as more serious offenders are brought in. Police have to cite and release offenders who they would prefer to commit to the jail because there's no space in the jail. Offenders are not arrested for failure to appear to court because, again, there's no space in the jail. So the physical condition and the lack of capacity really present serious issues with your current jail facility. Evidence-based practices?
Y'all still doing okay? Good pace? Good information, help as a backdrop? Okay. Evidence-based, I just have a couple slides on this. We did a whole workshop on it because the community voted that being as one of the topics they wanted a specific meeting on. I'm just going to highlight it here through the literature review. I've been a criminal justice researcher for over 25 years. And with that, with the literature review, we're able to put together a huge documentation for this effort. And the details of it, of course, will be in the final plan. And I started doing that when I was 12, by the way. Best practices. Boy, sum this up in one slide. It starts with collaboration and partnerships. No one entity. If you were to create the most sophisticated, state-of-the-art prevention, intervention, aftercare, criminal justice system, it would fail without partnerships. So that's key. Corrections, treatment, the community, health providers, people with lived experiences, advisory groups. It takes the village, as they say. Pretrial risk assessment and programs. There is a science, validated, used all over the country. Parole and probation use this to help identify offenders at low, medium, and high risk to reoffend. It isn't currently being used. I know the sheriff, not to speak for you, sir, and staff talk about we have to get this in place here. This will help identify people who are most optimal and can maintain community safety while being in the community on things like work release or electronic monitoring. So that assessment and matching responses to risk level is key. The tool are highly predictive. There's some cases where it's not the end-all, of course. There's some cases you don't use it in. You'd have a low-risk offender, but the type of crime was so horrendous that there's an override. But it has 76% predictability, which is huge for a tool like that. Treatment and rehabilitation, targeting factors which influence crime. At that level of trauma we talked about, substance abuse, criminogenic thinking, criminal thinking. I can do this. Their insurance will pay for it. I can take that car. You know, there's a mindset. So treatment that addresses those factors, treatment for substance abuse, mental health, and in a trauma-informed care way is key in evidence-based practices. Looking at the social determinants of health and that interrelationship among them and crime is key in best practices. And accountability, diversion services, effective responses, secure confinement. Notice that it's not either let's be really soft on crime and just give treatment to everybody and crime goes down. It will not. It will go up. Let's be really hard on crime and just lock people up and they'll just feel so bad about it they won't commit more crime. They will come out and commit more crime with that approach. There's over 50 years of research on this. And not one study, hundreds of studies. Best practices marries those two. And why did that happen? I guess they felt it was such a powerful statement, we're done. That best practices in research, which we have many documentations and citations for you that will be in the final report, on that combination, the risk management, combination of corrections and treatment, was echoed and aligns completely with the feedback from the community. We didn't have a scenario or a situation where we know what works, but your community was asking for this. We had an experience in working in Benton County where we know what works, and your community members said both of those are highly important. That balance of corrections and treatment or combination, I would say the dating is over, the marriage is here. Law enforcement on the corrections side, diversion, jail, place for people who need that secure confinement, the victim's voice, ensure their safety. You have to have that as part of the continuum. Specialty courts like drug court, mental health court, electronic monitoring, probation, parole, accountability. The treatment side targets those risk areas, builds skill, helps people leave the system more capable of living positively, starts to provide and links people to treatment for things like substance abuse, which you saw is how high nationally for prisoners, people in the jails? Substance abuse, mental health, trauma-informed care, etc. So the combination of the two leads to this. The blue one shows when you have that targeted, balanced approach, crime goes down. In this meta-analysis, 40%. I've seen it also as high in evaluations I've been involved in over the time, as high as 65% when you have a really strong best practice approach. When you don't do that in those red ones, it goes up. Fear of punishment does not prevent it from me. I'm going to stop at the light. I know if I go through it, something could happen. I don't want to. So that works. Plus, I don't want to be part of a chaotic society. I want to help us all live well together. But I don't have that empathy button turned off because I was so exposed to trauma as a child that it just doesn't work in my brain. That fear, shaming, exasperates acting out. It does not stifle it. Physical activity, that's a very popular, used to be. Send them to camp, have them work out, they'll stop committing crimes. You have faster, stronger criminals. Now, if you have that approach that mixes it with the other pieces of what works, that's a higher outcome. So I'm not saying these are completely invalid. It's just if you do them just on their own, you increase crime. The very thing the whole system is set up to do Reduced victimization actually increases it by not having that combined approach. So we looked at all that. We looked at the evidence-based. We looked at the data. We looked at previous studies. We looked at the research. And as you saw in hearing those individual slides, here's one that maybe goes to the punchline. We could have showed just this in 20 minutes out, but we wanted you to see the details we've been looking at. Your system is under severe stress. There are high numbers of failure to appear, reliance on forced release, inadequate facilities. In some cases, the word dangerous might be thrown in there. I'm not an alarmist. I'm not a sky is falling person. I don't think we should sell people something because they're afraid of something else. It demonizes individuals, and it's not true. What is true is you have some high-risk situations in your buildings. Lack of programs to address the underlying causes. Limited data on offenders' needs. No space to deliver treatment in focused approach ways. Not using evidence-based practices or risk tools to help with deciding what responses match the risk. On the what works, the classification system we talked about, combined with corrections and treatment, and the community responses align with that best practice. So now we're going to go into the scenarios. The scenarios are based on the beacon of, well, two things. Synthesizing all this information we shared, plus a lot more, but to give you highlights of what it was. Synthesizing all that. And looking at what is a effective, efficient, equitable criminal justice system that maintains public safety, holds people accountable, and helps provide treatment so they can leave more capable of living successfully in the Benton County community, your neighbors, your community members, your fellow citizens, than they had when they entered the system. The goals of the system are rapid, effective responses to crime, efficient processing, incarceration, use of jail beds for the people at highest risk, and have treatment programs to help, again, with skill building and living more successfully. The pathways to achieve those goals are through social services, law enforcement, jails, courts, community corrections, and system support. Carl, I'm going to look to you to go into the scenario and the details. This is really exciting stuff. This really is a drum roll part. Carl, no pressure. He was looking at me like, thanks, I didn't do that to you when I handed you the mic.
I was going to say, you've got a very low threshold for excitement, Ari. So when we looked at putting the scenarios together, we wanted to ensure that we dealt with each of the following areas: prevention, looking at the programs in the community, the social service investments that can impact the issues that Ari's been describing. So we look at expanded mental health treatment, we look at community substance abuse treatment, we look at transitional housing for the serious homeless issue problem you have here in Benton County. The next bucket we look at is enforcement. So how do we invest monies to ensure that policies that law enforcement agencies can ensure public safety, that hold offenders accountable, and you have facilities that can support effective and safe operations for both staff and inmates. We also look at the justice system in terms of the courts. They also need safe and efficient facilities. They also need adequate staff resources to allow the system to process offenders efficiently, move them through the system in an expeditious manner. And then we also look at accountability and rehabilitation, which gets to the fact that you need sufficient capacity to support the needs for your law enforcement system and your courts. You need incarceration based on assessed risk of the community so that the people in jail are there because they pose a legitimate risk to the community or themselves, and the people that can't be managed in the community are placed in the community. And then you also need evidence-based programs for those people confined to reduce recidivism and deal with their underlying issues that have resulted in their being in the jail in the first place. So those are the key areas in the different scenarios that we wanted to address. We have three different scenarios. The first scenario, scenario one, is a best practices scenario. So here we take the best of programs in all those areas we just discussed and put them together to determine what impact it would have on the county justice system. So in terms of the actual process map that we had developed earlier, on the prevention side, again, we look at adding community mental health and substance abuse treatment. We look at adding a new respite center, which is essentially crisis intervention. So it's people who are experiencing severe mental illness, need a crisis intervention. It's short-term stays for them to stabilize them. We also look at a new sobering center for the people who are chronic alcoholics, getting them diverted away from jail where they can don't necessarily have to be to while they process getting sober. On the law enforcement side, we look at the new law enforcement center. As we discussed, there's a need there. We also look at reducing cite and release policies to about 15% of arrests. As we said earlier, about a third of arrests currently result in a citation and release. On the court side, we look at pretrial services to do a better assessment of people coming into the system. We look at electronic monitoring for people on the sentence side to get them, again, out of the jail if, in fact, they don't require that level of incarceration. We look at a work release center so people can maintain jobs and maintain activities in the community upon sentencing if, in fact, their offense and their risk assessment profile allows for that. We look at updating the offender classification system, again, so you can do effective classification and risk management of the inmate population. We look at adding in-custody treatment programs to address, again, the underlying needs that are causing recidivism for serious offenders. In this particular scenario, we're looking at a new 112-bed jail. That is the level of capacity we think the system requires based on the implementation of these other programs. We look at a new courthouse that will address the issues inherent in the current facility, and we look at lowering the failure to appear rate to, again, the national benchmark, which is 5%. On the court side, we look at adding 8 additional deputy district attorneys to bring that office up to a level comparable to an efficient operational system comparable to what we see in other counties in Oregon. We look at mental health and substance abuse treatment while in jail and a new restorative justice program. On the reentry side, we again increase transitional housing support and put in additional reentry programs to provide those links to community-based treatment for offenders as they leave the system. Overlaying all of this, we increase data capacity so you can actually measure the impact of what you're doing. We want evaluation efforts on the system so we can see exactly what impact each of these programs has. We look at training for law enforcement personnel, and we look to establish an equity advisory council to address issues of equity in the justice system as it affects the community. So, what is the impact of this? So, we had done a projection of where your jail population would be over the next 25 years. Out to 2040, actually, so 22 years, excuse me. So we see basic growth in the jail population over that period of time of around 27 over your current average daily population. It's based on essentially growth in the county jail population, projections of population growth around the local community, crime statistics, what we see going on elsewhere in the local justice system. We look at the impact of eliminating forced release and eliminating matrix release, which is release on intake. We also look at reducing cite and release and lowering the FTA rate to 5%. All those factors increase your jail population. So if you did all those things, you would have a jail population. Can't really read the numbers, kind of off the screen there, but it increases the jail population of approximately 130. So at that point, then, you put in place these other programs to reduce that population. So we put in effect the respite center, sobering center, transitional housing in the community. And you can see the population, how that affects the population change there. In the jail, we put in pretrial services, electronic monitoring, work release, in-custody programs, and you can see the impact there. So that gets the jail population down. If you implement all those programs, it gets the jail population down to around 96, I believe. Okay, and then what you need to do then, because that's the average daily population, you need to build in additional capacity to take into account that you have peaks. You have fluctuations in the jail population. It's going to go up and down. You need to accommodate those peaks. You also have to accommodate different classifications. So you'll have a unit for maximum security inmates. You'll have a unit for female inmates. Those may not be used fully all the time, but you have to have those units in place nonetheless. So there will be empty beds. You will never get to 100% utilization. In looking at the data here, we think you need basically a 17% factor on top of your average daily population to accommodate those changes in population, different classification levels, female inmates, and those factors. So that gets you to an overall bed need for a new facility of 112 beds. In terms of how we would recommend you allocate that capacity, we would suggest you establish an 8-bed mental health unit within that facility, 16 beds for females, a 16-bed maximum security unit, and then 2 general population units, which would total 72 beds, so 36 beds each. And that, again, gets you to a facility of 112 beds. That's still a relatively low capacity for the size of your county. It still puts you in the bottom rung of incarceration rates for Oregon counties. But the reason it does, the reason it's that low, is because of all the programs you've implemented, taking those inmates out of the jail system. So these numbers, again, are very hard to read, but this is the financial impact of those decisions. All right. So, no problem. Yes, sir. Yes. So what we've done here is we've broken down the cost for these programs in terms of capital or one-time costs, annual operating costs, total for year one, which would be the combination of both the capital and the annual operating cost, and then project out for 5 years. So you got a 5-year picture of how much the total cost of these programs would be. So in the first area for social services, prevention and treatment, you've got a total investment over the 5 years of about $8.4 million. About $2.5 million of that's for facilities, for the sobering center, transitional housing. The rest of the funds essentially go to the operation of those programs that are being put in place. On the accountability and rehabilitation side, you've got a 5-year total cost of $126 million. The big pieces there, of course, are the jail, around $56 million in total cost, both 5-year annual operating costs, $22.6 million construction costs for a 112-bed jail. The law enforcement center, we estimate that at around $26.5 million to build that facility. And the courthouse, we estimate about $31.2 million to build that facility. So those are the big drivers of that cost. And then in addition to that, you have all the different programs we're putting in place. There are some capital costs associated with the work release center. But other than that, everything else is an annual operating cost, which gets rolled up to 5 years. So again, $126.5 million to accommodate those 3 new facilities and the additional programs. And then we have about $250,000 over the 5 years in system support, again, for the data collection, evaluation, training, and the equity advisory group. Get you to a total cost of about $135 million over the 5 years. Yes? Those are today's costs. Yes, sir. No. We do not have property costs built into these. They do include soft costs for planning, architecture services, furniture, everything that goes with the facility itself. It does not include property costs. Yes, sir. Correct. These are total costs to staff this new facility from. Correct. You would net out your current operating costs and your current contract with Norcor. This simply shows the total operating cost of this facility. Yes, sir. Yes. We made no assumption on how you choose to purchase. I mean, this was simply a 5-year look at what the total cost. I mean, we could certainly do that if you wanted to see what the cash impact of the county was. Um, this was just felt to be a simpler. It gives you the total cost of the facility. Gives you a simpler look at what the total cost would be. But right, we wanted to keep this as clear as possible at this point. Yes, sir. Yes. Yes, ma'am. The in-custody mental health treatment is 2 mental health professionals providing services on a full-time basis within the jail. The CBT program, cognitive behavioral health, that's a behavioral health counseling program provided on contract to offenders that are staying longer than 30 days. So it's provided to a smaller group of people, and it's provided on contracts. It's not provided by 2 full-time staff. Yes, sir. I mean, at that point, you have to project when bad things will happen, right? I mean, yeah, I mean, the simple answer is, yeah, you can make any type of calculation based on whatever assumptions you want to make. So we can say there's probably more crime in the city of Corvallis because of the inability to lock people in the jail who require incarceration, who are not getting treated for their underlying issues, who do not have access to programs. We can probably put a dollar value on that crime, on the cost to society of that crime. The issue, though, those costs are diffuse. They're spread across the county, you know, population as a whole, as opposed to these are costs that are directly attributable to the taxpayer. So it's a difficult comparison. Yes, ma'am. I'm sorry for what closure? Courthouse. I mean, those are based on standard cost per square foot. When we're involved in court facility projects and jails across the country, so we have a pretty good handle on what the construction costs are for different types of facilities. Courts are more expensive than you realize, um, and they take a lot. They square footage more than anything else. I mean, you have a lot of functions located in the courthouse which take up a lot of space. It's a bigger facility. The courthouse will be a bigger facility than your jail. Yes, sir. Well, this is the equity advisory group, right?
Yes, sir. Yes, so are we. Absolutely. One of the reasons that you saw on one of these pages was increased data capacity. So we can start to look at those numbers. As I mentioned earlier, there's a lack of data that we need to have, both hard numbers and people's stories of what's happening, and that link to the equity advisory group to close that gap between the voices and the correction system. So we've thought of it on multiple levels: enhancing data, evaluating the impact of services for everyone, and then by subgroups. So you look at how effective it is across the board. You look at time in jail for everyone and for subgroups, male, female, and based on race, ethnicity. You look at how your risk assessment tool is equitably applied across populations. All of that is part of the evaluation, and then some. I'm just touching the top to answer your question. Have we thought about it? Absolutely. And do we have strategies for implementing it into these pieces that we're presenting tonight? Yes, that's what will allow us to do it, including the evaluation. There's some wonderful evaluation designs to help answer your questions, and then some. I want to do two things. I want to get to a couple more clarifying questions of what's in here, and I want us to show you the other two scenarios. Okay? So and I love your questions, by the way. These clarifying questions are spot on and really get to the heart of things. Are there any other clarifying questions? And then we're going to go to the next scenario. Yes, sir, and then I'm going to the back of the room.
About $5 million in the jail. No. No. Well, just because you're building a new courthouse does not mean you demolish this historic facility. I mean, it could be used for another purpose.
Actually, I have looked at the studies that have nationally looked at the bias against different race ethnicities and those risk assessment tools. And there are methodologies to test the extent to which it's being used in any jurisdiction. So there are tools to help answer your question. Yeah, yeah. Sorry, I didn't answer that.
Mr. Detweiler? No, no. No, I mean, you could obviously cut and mix together these different programs in a lot of different ways. We wanted to provide three different scenarios and provide three different approaches, three different logical ways of looking at how you might respond to the issues in the system. The assumptions necessarily are, and the projections are somewhat arbitrary because they're based on a lot of assumptions based on what we know, but they are giving you order of magnitude understandings of the cost implications of what these different policy actions, where they'll take you. Ma'am? very, very possibly so. Scenario 2. Okay, scenario 2, the theme in scenario 2 is investing in social services. So we are taking basically scenario 1, the best practices, and eliminating most of what we're doing on the law enforcement side in terms of programs. So the emphasis again is on investing in social services to address the underlying issues that we see in the justice system. So again, we have all the same issues, all the same programs under community services that we had in scenario 1. We keep the cite and release policy the same in law enforcement. We now have a 144-bed jail required in this specific scenario, and we'll walk through the reasons for that. We also have the new courthouse that's same as it was in the scenario 1, and the failure to appear rate lowered to 5%, same as scenario 1. District attorneys, the same, and restorative justice, also the same as in scenario 1. And then we do have some increased transitional housing support and reentry. So, and also the overlying the data capacity evaluation and the equity advisory council and training. Those stay constant throughout all these different scenarios. So, impact here. Base jail population increases at the same rate. We still eliminate forced release. We eliminate matrix release. We bring cite and release down to 15%. But here, the only programs we're putting in place to reduce the jail population are in the community. So we put in place the respite center, the sobering center, and transitional housing. That's it. Okay? So that gets us to an average daily population of 123. We add on our classification and fluctuation, population fluctuation factor. We go up to 144, a need for 144 beds. So because we don't have those additional programs in the jail, which reduce the jail population, the overall capacity of the facility needs to increase. So 144 beds. Basically, you keep your mental health unit, your female unit, your maximum security unit basically the same, but now you have two 104-bed general population units, which require a little bit more to operate because they're bigger. So the cost implications here, you can see what we've taken out here. Basically, all the programs on the accountability and rehabilitation side, those are all blacked out now. On the top, on the social services, we still have an investment of around $8.4 million over 5 years. It's the same as you saw in scenario 1. In scenario 2, though, all we have is the 144-bed jail. The capital cost and the operating cost is a little bit different because of different size. We still have the additional deputy district attorneys, and we still have the new courthouse. We took out the new law enforcement center in this scenario. So that gets us to a total cost of about $102 million for the accountability and rehab portion of the plan. And the largest part of that, of course, is on the capital side, the new courthouse and the new 144-bed jail. System support stays the same at $250,000. So the total cost of this scenario is $110.8 million. And again, yes. We basically took the recommendation of the district attorney in terms of what his needs were and then validated that looking at what staffing was in other Oregon counties. I can't speak to how many he currently has. 8. Thank you. And 1 vacant position. Other questions on scenario 2? Yes? It could be either one. It could be co-located with the jail, which is probably preference, but it could be a separate facility co-located, or it could be additional construction at the jail. All right, scenario 3. In scenario 3, a different theme. We eliminate the investments in social service programs in the community and instead add back in all the programs on the law enforcement side and the jail side. So in this scenario, you see nothing on community services. Law enforcement, again, stays the same. We add back in all these programs, all these initiatives on the jail side. So you can see, and it results in 120-bed jail, 120-bed jail, and we'll go through how we get to that number. We also have, again, treatment in the jail for mental health and substance abuse, restorative justice, and the additional deputy district attorneys. Data capacity efforts consistent all throughout each scenario. All right, and here, again, we basically walk up to about 130, a need for 130 beds in the jail, and then we implement all the programs you saw in scenario 1. Pretrial services, electronic monitoring, the work release center, the in-custody treatment programs, and that gets you down to a population of around 103. We add in our classification and population fluctuation factor, gets you up to 120, so 120 beds. Again, in the scenario here, again, we have the mental health unit, the female unit, a maximum security unit, and then 2 general population units of about 40 each, gets you to 120 beds. The cost on this, and you can see we just zero out everything on the top for social services. On the bottom, the thing that changes here from scenario 1 is we now have a 120-bed jail, so the construction cost changes somewhat, as does the operating cost. Everything else in accountability and rehabilitation is the same, with the exception we did take out the law enforcement center. And then system support is the same. Total cost for this scenario, about $102 million over the 5-year period. Yes, sir. Yes. Basically, I think it gets to the fact that if you're going to create a justice complex or campus, best practice would indicate you want to co-locate as many of your justice functions in that one area. That would be the primary rationale. Right. Yeah, 911 center requires some level of investment anyway. You're going to spend money to address the issues with that program. CPD is looking at possibility of the need to increase staffing. They don't have the ability in the current facility to support increased staffing, so there are issues with the law enforcement center. Well, it wouldn't be in scenario 2 because scenario 2 was just investing in social services. In scenario 3, we wanted to look at just the jail. We're looking at programs just in the jail, pretty much, with the exception of the courthouse and the DAs. And again, some of this is relatively arbitrary. We had to just make some decisions on what to include and what not to include. You can obviously mix and match this in whichever manner makes sense to the community. Yes, sir. Yes, sorry about that. Is that working? Okay. Yes. No. Yes. No. Yeah, and I think there's a recognition on the part of both the sheriff and Chief Sassaman that some level of cite and release is appropriate, and that's why we went to them and asked them what level would you feel comfortable with, what level of those arrests can be diverted to the community, and that assumption came from them essentially, that they felt comfortable that basically about roughly half of the people they're currently citing and releasing really do belong to be at least booked and processed through the jail. Maybe half of that can be cited and released in the community. Yeah, that's part of our, again, breaking the facility down into different housing units. So you have a separate unit for maximum security, for mental health. So they're kept separate, and be able to manage separately. Yes. Pardon? No, no, not at all. Not at this point. Oh, okay. Yeah, the question is, do we look at different scenarios for where to locate the facilities and what the potential cost impact of those facilities or those locations would be? And no, this is just conceptual projections of cost based on the program elements. We didn't want to go down and make any assumptions in terms of the price of property, what property would be available, whether some of it could be shared with the city of Corvallis, whether we could look at possibly sharing with another county even. So no, we didn't make any of those assumptions. This is just the cost of the program elements themselves. Yes, sir. Yeah, the question is, do these all scenarios eliminate the need to ship inmates out of the county? And yes, each scenario keeps all Benton County inmates in Benton County. Yes, ma'am. The question is, is this basically it, or is there the ability to consider additional scenarios or different ways to look at this? And of course, the answer is, again, as I said, you can mix and match this stuff in any way which makes sense, essentially. Yes, ma'am. There's a very low level of current mental health treatment going on currently in the jail, so we're adding actual full-time staff to provide additional services in the jail. Well, oh, yes, it's additional to, there are, actually have a very robust social, community mental health and substance abuse treatment program in the community here. This is adding additional resources to focus on the criminal justice population. I'm sorry, could you repeat the question? It's increasing the overall capacity of the current programs you have in the community. The issue is there's not enough resources to provide treatment for all the population that needs those services. Some of that population ends up in the criminal justice system. Yes, 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 sir. Yes, I mean, to the extent they're currently bringing inmates in there, and we see what that intake is from Oregon State, excuse me, that is taken into account. Yes, ma'am. The question is what size of land would be required for a justice complex. And to be quite honest, that's not my area of expertise. I'm not an architect or facility planner, so I would, rather than give you just an off the top of the head question, let me do the research and get a specific response to you on that. Yes, ma'am. The jail could certainly be elsewhere. The courthouse, I believe, has to be in Benton County. Yes, ma'am, all the way in the back. I have no idea. I'm assuming that's probably been an issue that's been approached with the college in the past, and I have no idea what the prospects would be for the future. Yes, ma'am. Yes. Yes. Yes, sir. We did an inventory of services that were available in the community. I'm not qualified to tell you that they're adequate for what your need are, but I will tell you that they're very robust compared to what we see in other counties around the country and with what we're familiar with what goes on in the state of Oregon. Ari, perhaps you've got a better sense for that?
We looked at the array of services and the implementation of best practices for behavioral health services in the community, and those are robust. Are they meeting all the need? Well, probably not. We looked at the level that's currently being served. We looked at the numbers of offenders that we estimated with proxy data that would need additional services, and working with staff from the department added those on. That's the logic behind it. But does your array and utilization of best practices for behavioral health services, is that high in Benton County? Yes, sir. And I could go through them and tell you their outcomes and everything else. Any other questions? Yes, sir. We did a couple things in looking at addictions, and you're right, it's very high. You saw the data that nationally 64% of inmates have some type of substance abuse problem. It is very high. What you didn't see, because we had probably 45 more slides in here, and when we did a test run this morning, the group that saw it said, by the time you got to the scenarios, I'm asleep, and I'm confused. So we took some out, and there's this balance of how much information is helpful to understand what we've done and how much is so much that you're saturated with information and taking in the scenario information gets diluted. So maybe we erred too much by cutting out. And what isn't in there is the information on substance abuse treatment and the success of substance abuse treatment that's tied to medical-assisted therapy for people leaving the jail. Take away this soundbite. If you're using MAT at the jail, what did I say earlier? It's a place where people by default get sober. If they connect with MAT services, medicine-assisted therapies, I should say, while they're in the jail for opioid use, not meth, because I haven't come up with MAT for meth yet, but for opioid use, and they leave the jail on MAT, the relapse, let me do this. They leave the jail without MAT. Their relapse rate is what? 92%. If they're on MAT, their relapse rate is what? 25. The data and science on this is incredible, and they've tested, the science and the studies are based on starting this therapy while people are in the jail. Because opioid users are not running to our treatment programs in the community. They get there. They certainly get there with help, with enough failures, with almost deaths, with doctors encouraging them, with families doing interventions. They get there. But not at the rate of what happens to people who are incarcerated. And that treatment is highly successful. So we have a lot of information, a lot of studies on what fits in that evidence-based practice. Yes, sir. I'm proud of the question and the care, because that's what I hear in your community and in that feedback. Highly here is that care. I'm going to go here, then back, and then up to you. Go ahead, sir. That's opioid use. Oh, no, I'm sorry. Opioid and alcohol abuse. It doesn't, and heroin, oh, of course, heroin is an opioid. It does not include meth. They don't have a MAT treatment yet. They're working on it. Yeah, I'm talking about highly addictive, high fatality rates of drug use. I'm not talking about those more controversial, where does it fall in the recreation and non. That's not the group we're speaking of here. I'm talking about the people that have to be brought back to life because they OD. Yes, ma'am. Yes, ma'am. Yes, ma'am. And you were waiting. I said 1, 2, and 3, and I was like, who did I say? You were right in front of me, and that's going to go in the paper. Oh, no.
I'm not sure that I can get all the way there yet. We have not gone that far, and you're really starting to move into what is our the question was whether all of the facilities, the primary facilities, the jail, law enforcement center, the courthouse, would require new bonding activity in order to finance them, what other kinds of financing we might be able to contemplate at this time, or whether there would be other sources of funds. I think there will be other sources of funds as we start to move forward into design. I know that we have already requested from the state, and it's up to the state legislature to appropriate funds to help with courthouse design. We will be able to get some funding from the state for courthouse construction, some bond money from the state. So that will help a little bit on margin with some of these costs. We will have to go out to the voters and float a bond for the remainder of the costs. When it comes to the law enforcement center, if we include an upgraded emergency operations center, I don't know what the state of funding streams might be from either FEMA at the federal level or from the state for some sort of a contribution. That would be wonderful, but that's not predictable at this time. So we'll get into this a little bit more when we talk next steps.
So this essentially is nothing more than a summary of what you've just seen. So scenario 1, with the different assumptions, a cost of $135 million. Scenario 2, again, scenario 1 is best practices. Scenario 2, investment in social services of cost of $110 million. Scenario 3, heavy investment in jail programs, $101 million. And you have different size jails at each 112-bed jail in scenario 1, 144-bed in scenario 2, 120-bed in scenario 3. So, and we wanted to take a look at the impact of the different programs, and this is really kind of a misnomer. It's not really a cost-benefit ratio. It's really more of a return on investment. So what this shows you is for each dollar you put into the program, what you get back in terms of savings. So if you're over $1, if you're over the bar right there, that's the return you get on $1 of investment in the program. Below that, it's actually costing you money. These are just hard dollars, okay? So this is the dollars you spend on the program and the impact on reducing the jail population. So it doesn't include impacts on crime in the community or those larger societal costs. Those, to do a true cost-benefit analysis, you'd want to factor that in. You want to take this out to at least 20 years. You want to apply a discount factor. That is not this. This is simply showing you what you get for each dollar you invest in these programs over 5 years. So you can see the largest benefits you get are for, in terms of cost, are electronic monitoring, pretrial services. Those are only costing you 45 cents for every dollar you're saving. The programs that are more expensive are the respite center, in-custody substance abuse treatment. Again, those have a lesser impact on the overall jail population, and they're relatively expensive, so you see less of a return on investment in those specific programs. But that gives you some idea of the relative impacts of the different programs in terms of cost. True. Yeah, so this is a 5-year window, so a lot of these scenarios include some construction, as in the respite center, or some capital acquisition. So you have that entire capital acquisition reflected in the 5-year window here. So that's kind of overstate, perhaps, or understate the actual return on investment you make in those type of programs. So that has to be taken into account. Next steps.
Where do we go from here? What can you expect to see from this information in terms of next steps? Wanted to cover some things that might impact the assessment. Early on, I shared with you all one of our values was transparency. So what we know, we're going to share, or maybe overshare sometimes. But this is what we know today. We know that the Justice Center's Council of State Governments, which is a federal organization, is working in Oregon doing an assessment on the needs of people in the correction systems who have mental illnesses and co-occurring issues. They're going to several communities and collecting information, data, or identifying where data is missing, and through our next legislative process, they are going to be making recommendations. So there might be some mandates in the future about better serving that population. Hopefully, there are funded mandates in dealing with that population. But all over the nation, it's becoming a very difficult issue. And so federal TA has been helping and looking at that. The other thing that we know has occurred is, of course, other communities have heard about your criminal justice assessment and have had preliminary interest in maybe a regional jail. And those are preliminary initial conversations, calling the commissioners and saying, what might that look like, and it's being investigated. Is that a good summary of it, Commissioner? Okay. And what happens with that is completely unknown. These scenarios were developed, obviously, without that. If that opportunity arose and if it fit the need and all those other ifs, then it would be explored along with costs and how it impacts these scenarios would wind back to it. But I want people to know that's out there now. So down the road, it doesn't come in from the side. It's like, wait, we just heard all this assessment. Where did that come from? It came from people being interested. It's something that needs to be looked at. For the timeline, December, we have a final Benton County Criminal Justice Report that Carl and I are working on in conjunction with, of course, Benton County partners. Then we will have a final presentation. In 2019, 2020, transition the implementation work to your local public safety coordinating council, which is the Willamette Criminal Justice Council. Also establishing that equity advisory council we see is happening earlier in the steps. It's much needed sooner. Pre-trial release program and site selection, facility designs with what programs, if any, needs to occur during that time. And then through those 2 years of 21 and to 23, the bond measure, construction, or other funding, if there's other funding support, what that might be. That's a big word. In the next 10 minutes, well, we've heard some of your thoughts. You've heard a lot of your questions, and really great ones in helping to define what we're talking about. So thank you for that. And I am curious, as you hear this, what percolates up for you. As we said, I want to highlight there's scenarios in draft. These aren't the 3 engraved in stone. Items might be moved around, but we wanted to incorporate what we learned into this is optimal in terms of best practices. This is if you decide to weight it on the social services and the community. This is if you decide to weight it on just the on the criminal justice piece. So there's probably some variations in there, but it gives you an idea of what the costs associated with those are, or at least the range. Yes, sir. How might it look like if we go on this track and then the regional jail becomes more viable after the fact of this work? So, Commissioner, can you help with aligning that with the timeline, please?
Sure. With respect to the potential for a regional jail, as we move forward in thinking about a jail location, we would start that conversation at a greater intensity with the county or counties that are interested in potentially working with us and sharing the costs for such a facility. So I would anticipate that those conversations will start to pick up in the next year as we start to talk about what a new jail would look like and what our proposals are for a facility and what programs we want to have in it. So that's what I can tell you at this point in time.
Yes, the question is, will we be able to tell exactly how many people will be impacted by each of those individual programs that are identified in the scenarios? And the question is yes. I mean, the report will fully spell out all the assumptions used in detailing out the impact of the programs and how the costing assumptions were deployed to develop the numbers you see on the scenarios.
Thanks, Christine. That's a softball question. I would say that it's the Board of Commissioners, your elected representatives of the county, and the gentleman sitting right behind you, our county administrator, and our finance director, Mary Otley, who's also in the audience, will be thinking about these questions long and hard. And yes, we will be looking for all sources of funding possible in order to put together the best package possible and have to go out to the voters for the least amount of money possible. So we We really are looking for the best bang for the buck, and I think siting decisions are going to be a critical factor when we look at this. One of the things that I've been thinking about a fair bit is the fact that, yes, if we use our existing properties here in the downtown core, that means that we have to move everyone out of these buildings at some point in order to remodel or redo or tear down or whatever, which adds a whole nother level of expense into any kind of project. If we go to a bare property, we don't have to do that, and we avoid all of those relocation expenses, but we have to buy land. Then we could sell land. There are all kinds of things to think about. Those are the kinds of discussions that we are going to have over the next year and a half, 2 years before we ever go out for a bond measure. At least at this point, we have a good sense for what programs and facilities we need and what the best practice is and what we would like to have, so we can think about how to do it.
Thank you, Commissioner. I'm going to add something that I don't believe I've ever said at the ops team meeting or publicly in response to your question, and not to at all contradict or say all of the above is true with the board and county administrator doing their work. And why sit back and watch them fail or succeed as a community when you consider it a no-brainer? Why not call them and say, what can I do? There's about between 400 people who clearly 500 said that scenario is it, that combination. How many could go and do what I'm doing? I'm glad to come back and do a public meeting, an educational piece instead of PowerPoints. I would rather empower community members to come out and talk to your fellow neighbors, your people at work, the spiritual communities you belong to, the schools your kids go to. If this is going to happen, that partnership includes the Benton County community speaking to it, not Carl and I. So the educational piece and helping the community understand what it is and why, I'm going to put a mirror up and ask you all and more to call the commissioners and say, what do you want me to do? Will Ari put together a slideshow for me and come and talk to me about public speaking? Should she be there if I'm not comfortable with it? Yes, yes, yes. Is it part of the contract? No. Will she come back and do it anyway? Yes. Next question. I never said that before. It's not going to work if you look at 5 people to do this. It is not going to work. Don't do it. It's not going to happen. You all are out there in your neighborhoods. You live here. You're a better spokesperson than I am. We'll help, but I'm not going to preempt the voices of the people who live here. I believe in you all too much for that. Yeah, Rose.
I can tell you a little bit more about what we're thinking at this point in time. We started out a conversation with 4 counties on the west side of the Cascades, talking about the potential for a regional jail. When I started to think about the logistics of that and trying to mesh the needs of 4 counties, it seemed really overwhelming. And they're very different counties. At this point, we are having a conversation with Lincoln County. And Lincoln County, it's not that far a drive, especially with the improved highway. They have their own needs in terms of facilities, and what they would really like to invest in alongside Benton County is a mental health unit. We all know that we have people, inmates, community members in our jails that need a different kind of treatment than an isolation cell if they are having a lot of trouble, but they are justice involved. So they also would very much like to have a little bit different capacity. So it would not be, and they are amenable to a facility being in Benton County because it could be kind of equidistant between Corvallis and Newport, or there are all kinds of potential considerations. We haven't gotten anywhere near that level of detail, but it's a logical neighbor. When you look at Lane County, that's 3 times as large as Benton County. They have, a central Lane County jail, and covers a much larger territory. So I think Lincoln and Benton are very doable that way. But again, extremely early stages. Okay, I guess we have one last question, a couple last questions. That is a good question, and we didn't break down the arrest data by, yes, we did, by age group. We presented that in the very first presentation that we gave. What we didn't do was break it down into the 18 to, say, 25-year-old bin. It was 18 to 30-something. So we didn't capture that student footprint quite as well as we might have. We can do that, and I think that would be helpful. One of the things that has been recommended in the past is a sobering center, but one of the things you saw here is that a sobering center would maybe reduce the jail bed need by a couple of beds. And I think part of the problem is that we have that need in a very, very spiky way. And those peaks occur around Mom's Weekend, Dad's Weekend, football games, Halloween. So that's part of the reason that a sobering center as a facility with those construction costs might not pencil out. Did you have another question, Bennett? Okay. With that, I thank you all very much for coming tonight and for your fantastic questions. You asked great questions. And all of your questions and input will help shape the narrative report that we put together. We have a lot of work to do moving forward, and I do hope that all of you will join us in doing that work. Thanks.